Hello ladies and gentlemen and fellow classmates. We're at risk. My name is Harold Hackney. I'm a nurse, and like many of you, I am concerned about the recent outbreak of Ebola virus that has threatened our well-being. According to the Center for Disease and Control and Prevention, CDC, this 2014 outbreak, which began in West Africa and has been the largest in history. And while West Africa may seem far away, I assure you it's only a plane ride away. In fact, just this past Thursday, October 2nd, 2014, Ebola was found in Dallas, Texas, according to the reports from Channel 7 News Team. Left uncontained, this wildfire will spread and consume us. If we as individuals and as a nation hope to win this battle, we must arm ourselves with information. Use universal precautions as our sword and strategically attack and eradicate Ebola. It is essential that everyone knows the facts about this treatable but incurable disease. The CDC provides a wealth of knowledge about the specifics of Ebola on its website. For those individuals who do not have access to computers, I am compelled to educate and to inform. To clear any misconceptions, Ebola is transmitted through the exchange of direct contact with bodily fluids with someone who has the virus or is symptomatic of the virus. Some body fluids include blood, sputum, urine, semen, and feces, which I have a slide right here to show. Well, these are some of the signs and symptoms of the virus. This can include headaches, muscle pain, weakness, diarrhea, vomiting, stomach pain, any bruising or uncontrolled bleeding, just overall a person's general health has declined from previous state. Now, I know a lot of you may be thinking that, this sounds like every other disease that we're warned about. But if you exhibit any and especially all of these symptoms, seek immediate attention. Again, a disease is not curable, but it is treatable by administering medications aimed toward the immune system. The incubation period after exposure is about 8 to 10 days, but it may be as early as 2 days. It may take up to 21 days for the signs to show. Knowing the pertinent facts about Ebola is our first line of defense. Okay. Let's talk a little bit about universal precautions and how we can use them to protect ourselves and incorporate them into our everyday life. Okay, now just a few pictures of some universal precautions, like washing your hands, wearing gloves, and wearing a protective mask or face shield. Okay, these must become second in nature when dealing with Ebola, because it is important for you as adults and use the suggested techniques, but it's more important that we teach our children and remind the elderly of the importance of using universal precautions. After all, the survival of the disease depended upon our immune system. For more information on universal precaution and bloodborne pathogens, you can access OSHA, the Occupational Safety and Health Administration Manual, on your job or its website. Any hopes of eradicating this epidemic has to come by way of research and development. More than 1,300 people have been killed in Libya alone, according to Katie Curry's interview on Ebola outbreak. The Libyan President Ellen Johnson Sirleaf, as while progress is being made with experiment drugs, progress has been slow. So they're trying to find a cure for, well, not a cure or a way to treat or slow down a drug, but they haven't been successful so far at doing this. So In conclusion, awareness and action is a demand upon all of our parts. And I hope everyone be safe and have a blessed day. And just in your spare time, think about the Ebola virus and some of the things that I have mentioned here today that you may be able to pass along to someone else. Thank you.